name is Rodney Cabebe, and I'm giving an informative speech on an eye surgery called PRK, Photorefractive Keratectomy. If you ever had your glasses fog up while you were driving, or had your contacts dry up or fall out during basketball, PRK can be the solution to your problem. In 2007, I went through the PRK surgery, and I went from a 20/40 vision to a 20/20 vision, and I no longer need to use my contacts or glasses. In this speech, I'll go over the purpose and procedures, aftercare risks, and surgery alternatives for PRK. PRK started in the 1980s. Canada and Europe started using it in the 1990s, and it was approved in the United States in 1995. The purpose for PRK is to eliminate or reduce myopia, which is nearsightedness, hyperopia, which is farsightedness, and astigmatism, which is a abnormal curvature in the cornea. PRK is preferred over glasses because glasses can provide some restrictions during physical activities, and you want it for cosmetic reasons. PRK is also preferred over contacts because contacts can have dryness, pain, or cause corneal ulcers. You need to be at least 18 years old to do the surgery, and it costs about $2,500 per eye. In preparation for the surgery, you need to stop using your contacts at least 1 week before the initial exam and 3 weeks before the actual surgery to allow your cornea to form back to its natural shape. And this is the cornea right here, the outermost layer of your eye. And you need to stop the use of creams, makeups, lotions, and perfumes at least 2 days prior, and allergy meds and birth control pills to prevent post-surgery hazing. People with diabetes, glaucoma, scarred cornea, macular disease, or is pregnant and or breastfeeding cannot do the surgery. On the day of the surgery, you'll be given a consent form, given the permission of the doctor to perform the eye surgery. After that, you'll be given a sedative, usually Valium, to help you relax during the surgery, and anesthetic drops, so surgery will be painless. You ain't gonna feel anything. A speculum will be placed on your eye to hold your eyelids open, and the patient looks directly into a blinking light through a microscopic laser. From there, an excimer laser removes the epithelium. The epithelium is the outermost layer of the cornea. After it removes the epithelium, it reshapes the cornea or ablates it, which is called the ablation process. After the ablation process, you'll be given contact lenses to protect your cornea during the healing phase. You'll be also given antibiotic and anti-inflammatory drops for pain and prevention of infection. For the aftercare, you're advised to rest for at least 2 days. Make sure you got a driver to take you home because you won't be able to drive. And you need to attend the mandatory follow-up appointments 24 hours later. 4 days later, on day 4, they remove the contact lenses and give you steroid drops to be used for at least 4 months. 1 week appointment, 1 month appointment, 3 months, 6 months, and annually. According to PRK, the original laser eye surgery, some of the risks are glare, glaucoma, vision distortion or fluctuation, and even rarely total vision loss. According to imdlink.com, there have been reports for enhancement, which is when the patient has to go through the whole process again due to regressive results from the first PRK surgery. So it's kind of fades away. Alternatives for PRK are LASIK, laser in situ keratomy, which cuts the flap in the cornea and does the ablation process, which fixes the cornea and corrects your vision. It is less painful, shorter recovery, but you can have more complications. Or you also can do radial or astigmatic keratotomy for moderate corrections. According to the U.S. Air Force Refractive Surgery Program in 2011, the military prefers PRK over LASIK because the flap during LASIK can come open during combat. In conclusion, I went over before, during, and after procedures of PRK, and there are many vision correcting surgeries out there, but make sure you familiarize yourself with the risks.